Have you ever thought about what keeps you from falling over every time you take a step? Or what lets you dance, jump, and run? You probably don't give it much thought about it, but there is a superstar joint in your body doing all that heavy stuff for you, the hip joint. It's true what Sakira says, the hips don't lie. They reveal your balance, your posture, or even the way you walk. And get this, they are so strong that can handle up to 5 times your body weight with every single step you take and every move you make. But when there is something off, your body always finds a way to let you know. So we have to start listening and physiofy this together. Hey everyone, and welcome to another episode of Physio Talks with Tom. I hope you're healthy, confident, and more importantly, staying active. Today, we're going to talk about the incredible and sometimes underappreciated, the hip joint. You will understand how this amazing joint works, why sometimes it can give you trouble, and I'll share some simple and effective tips to keep it strong and pain-free. Let's go. As always, we start with the anatomy part. So what exactly is the hip joint? At its core, the hip joint is the most robust and mobile ball and socket joints. Think of it like this. The ball is the head of the femur, the thigh bone, and the socket where it's articulated is a part of the pelvis, the acetabulum, which this design allows us to jump, run, or dance, but it's also built for incredible stability, handling forces that can be 5 times our body weight. The socket is deepened by a strong cartilage called the labrum. This creates a suction cup effect, helping to hold everything in place and distribute force evenly across the joint. And of course, there are the ligaments, especially the iliofemoral ligament in the front, which is famously the strongest ligament in your body. It's like a built-in safety belt which prevents you to hyperextending and helps you stand up straight with less effort. Now let's move to the next part of the hip joint, the kinesiology. So the science of movement of the hip joint is the following. The hip is involved in nearly every movement we make. It works in 3 main directions. So in the forward and back, we have the flexion. In the side to side, we have the abduction and adduction. And in the twist direction, we have the external and internal rotation. Describing the flexion and extension in the first place, flexion is when, for example, you want to bring your knee to your chest, or for example, you want to walk and you want to lift up your body to make a step forward. And the extension is when you move your leg backwards. Explaining the abduction and adduction of the hip joint. Abduction is when we move side to side from the center, from the neutral position out, and the adduction is when you move it from out to in. The external and the internal rotation, it's for example when we twist your hip joint. These movements are crucial when, for example, we want to kick a ball. But here is the most important part. Your hip joint doesn't work alone. It is in a constant communication with the lower back. If there is a restriction or weakness in one area, another part has to compensate. This is why the hip pain can sometimes be related to an issue of the lower back, and vice versa. Now let's move to the myth busting part. Myth number 1, clicking in my hip means something is damaged. A lot of people get worried when they hear or feel a click in the hip, but often this is just a tendon or a muscle flicking over the bony part of the joint, a condition called snap hip syndrome. It can be noisy, but isn't always a sign of serious damage. Moving on, the myth number 2, just rest it. Exercise will make arthritis worse. This is a huge misconception, especially when it comes to the hip arthritis. While high-impact exercises might be adjusted or controlled, low-impact exercises can be very beneficial. Movement helps lubricate the joint, strengthening the supporting muscles, reducing the pain, and improving the function. Myth number 3, my glutes are switched off, that's why my hip hurts. This is another common one. The truth is, if you are standing, sitting, or walking, your glutes are working. They may not working optimally, but they are not asleep. Blaming one muscle group is an oversimplification. Hip pain is complex and often comes from a combination of factors, not just a single of muscle. Here are a few common hip conditions which can be a source of pain. Osteoarthritis. This is the wear and tear of the cartilage of the hip joint. It can lead to stiffness, pain, and reduced motion over time. Bursitis. A bursa is a small fluid-filled sac which reduces friction. Inflammation of the bursa on the outer side of your hip, known as the trochanteric bursitis, can cause significant pain, especially when you lay on that side. Tendinopathy. This is an overuse injury of the tendon in the hip, specifically often the gluteal tendons on the side and hip flexors in the front. It causes pain and tenderness when we use those muscles. Now let's move to another common condition, and this is a long one, the femoroacetabular impingement. This happens when there is an extra bone growth or in the socket of the pelvis or in the head of the femur of the hip joint, causing them to rub together and limit movement. This is often in young people. Let's go now to the main chapter of the topic, the physiotherapy tips and exercises. But before we jump to the exercises, I have to mention something very important. If you are diagnosed with one of the most common conditions of the hip joint and some other which I'm going to mention in the screen, and I say officially diagnosed by a doctor or a physiotherapist, it's important to get a visit to a physiotherapist to have some therapy, because the tips I'm going to give you are for emergencies or for something you can do, say, quick pain relieving, and not a therapy, because these are not therapeutic exercises exactly. These exercises can give you some pain relief, but not the therapeutic procedure. So be aware of what problem you have. Let's move on to the tips and exercises. Tip number 1, break up your sitting. This one I mentioned before, of course, get moving. It's my motto. If you want to keep living, keep moving, okay? Motion is lotion. I said it before, you know it. Prolonged sitting keeps your hip flexors tighten up. So, one of the most common exercises you can do to break this bad habit, let's say, it's squatting. Squatting, as I said on the video of the lumbar spine, is not just a movement, it's a state of life. Prolonged sitting can cause the hip flexors to get tightened. So, in this position, it's not so beneficial to stay in a long time. It affects your posture and tightness in your hip flexors if you stay in a prolonged sitting position. Usually, set a timer, maximum 30 minutes. If you want to stay sitting, then get up, move, lay down, stand up, walk, do another movement besides sitting. Tip number 2, you can use a foam roller to get a nice massage on the hip flexors, glutes, and all the area of your hip joint. Tension and stiffness can get reduced by using a foam roller or a massage gun applied on that area. Being gentle and avoiding bony areas when you want to apply those pressures, but focus only on the quads, the glutes, and the outer thigh muscles. When you are in the car, avoid to stay with crossed legs, because in case you are in a car crash, you will have a severe dislocation of the hips. Let's go now to the exercises. Exercise number 1, the bridge. Lay on your back with flexed knees and feet flat. Squeeze your glutes to lift your hips off the floor until your body forms a straight line from your shoulders to your knees. Hold for a few seconds, then lower. This is a great way to strengthen your glutes and hamstrings. Exercise number 2, the clamshell. Lay on your side with your knees bent and feet together. Keep your feet touching. Lift your top knee toward the ceiling. Then lower it back down. This targets your hip abductor muscles, which are vital for hip stability. Exercise number 3, quad wrap hip extension. On all fours, keep your back straight and core engaged. Slowly lift one leg straight back behind you, only as high as you can without arching your back. Lower it back down with control. This is another fantastic glute strengthening exercise. Next very important chapter is the prevention part. To prevent future hip pain, focus on these things. Number 1, variety of movement. Incorporate different activities in your routine so you can work your hip joint in all planes. For example, the flexion, extension, abduction, adduction, and internal and external rotation, as we said before. Strength and stability. Build a strong foundation which target all the hip muscles. Listen to your body. Pay attention to the early warning signs. A little soreness is normal, but persistent and sharp pain, it's a signal to modify your activity and seek advice. Cover the most common conditions which can lead to hip pain. Of course, there are other common conditions like dislocations or total hip replacements and other severe injuries in the world of physiotherapy. But in this video, we focus only on conditions that people experience and can address with simple exercises. They can assess your specific situation and create a plan tailored to you. If you find this video helpful, make sure you give me a thumbs up, subscribe to the channel, and of course, if you have any questions, you can leave me a comment down below. Thanks for watching, and as always, keep moving so you can keep living.